Hello, welcome to New Pod. Can lymphatic drainage make lymphedema disappear for good? Between dramatic before and after images, personal sensations, and outcomes that can truly be measured, the answer requires nuance. This episode examines possible benefits, known limits, and the importance of appropriate follow-up. Imagine seeing an ad with striking before and after photos from one session. It promises a slimmer body, toxin removal, and an immediate visible result. For someone living with a swollen, heavy, or uncomfortable limb, that certainty can create real hope. It can also increase anxiety when improvement does not follow. This fictional scene reflects a believable, everyday situation. A dramatic picture does not reveal the diagnosis, photo conditions, duration of the effect, or other care used at the same time. Before buying a promise, return to the actual problem being treated. New, persistent, sudden, painful, or red swelling needs medical advice. Advertising can never replace a clinical assessment. Comparing the ad with evidence does not deny every positive experience. Some people may notice symptom relief or greater comfort after drainage. That experience matters, but it needs precise language. Feeling lighter is not automatically a lasting reduction in volume, and a temporary visual change proves neither fat loss nor cure. The relevant outcome depends on the goal set before care begins. Comfort should be followed over time. Diagnosed lymphedema belongs in a clinical evaluation that considers the whole plan. Two people may respond very differently. Words such as always, permanent, and guaranteed erase that complexity. Responsible information accepts that a technique may help one situation, help little in another, or miss the original goal entirely. Lymphedema does not mean any swollen area. It describes buildup related to inadequate lymphatic function and is identified through clinical assessment. Similar appearances can have different causes and require different responses. Calling every swelling water retention oversimplifies the problem. Explaining heaviness, fatigue, or swelling as accumulated toxins is not an established medical mechanism either. The lymphatic system supports normal body function, but it is not a network that a session simply cleans. The reported symptom, the proposed physiological mechanism, and the diagnosis are separate levels. Keeping them distinct helps investigate causes, identify warning signs, and decide whether drainage is one possible option. General content cannot perform that assessment from a distance. Manual lymphatic drainage uses slow, light, directed movements based on anatomy. This describes how a trained professional plans treatment, but it does not predict the result by itself. A plausible mechanism can explain the intention without guaranteeing a consistent volume reduction. Cause, progression, affected area, health status, and other measures all influence the clinical response. The technique must be adapted rather than repeated as one universal routine. Its gentleness does not make it suitable in every circumstance, and direction cannot be chosen properly without assessment. For that reason, this episode does not provide a sequence to copy at home. Understanding the principle supports better questions. It does not replace professional judgment. The technique gains meaning through a justified indication, explicit goal, and coherent monitoring. A measurable individual benefit must be defined before treatment begins. Benefit does not necessarily mean cure or complete disappearance of swelling. Depending on the situation, the goal may involve a specific symptom, a comfort outcome, or a clinical feature followed by the professional. It should be concrete enough to review after a defined period. This avoids the vague claim that drainage simply does good and prevents the target from changing when the promised result does not appear. Measurement does not reduce every experience to a number. Sensations can be described by intensity, frequency, and impact. An immediate impression must still be separated from its persistence over time. The chosen measure depends on diagnosis. Defining useful improvement makes the choice to continue, adapt, or stop more transparent. Volume may be important in lymphedema follow-up, but it does not describe the whole situation. Evidence does not show that manual drainage used alone consistently reduces it. That statement is more accurate than claiming the technique always works or never helps. A patient may report relief while volume changes little. A measured change does not guarantee lasting benefit. Each finding belongs within the full care plan. A volume change must not be confused with fat loss because they are different outcomes. Duration matters too. A photo taken right after a session says nothing about the following days. A single measurement gains meaning within a trend. Separating the outcomes allows a targeted benefit to be recognized without claiming a broad effect that observations do not support. When lymphedema is diagnosed, manual drainage may be included in a broader strategy. It is generally one possible component alongside compression, suitable movement, skincare, and education. This is not an identical recipe for everyone. Compression has its own role, activity is adjusted to ability, skin receives regular attention, and education supports understanding and follow-up. Drainage should fit within that combination rather than displace other elements. The plan can vary with clinical history and change at reevaluation. Each component responds to a need identified during assessment. This complementary view reduces dependence on one service presented as essential. It also shows that relevant care follows a pathway, diagnosis supports the decision, goals guide action, and observed outcomes determine what happens next. After breast cancer, concern about lymphedema may lead someone to seek routine preventive drainage. Manual lymphatic drainage is not recommended as automatic prevention in this context. This does not mean every person has the same pathway or that no support is useful. It means repeated sessions without an individualized indication are not justified merely by the wish to avoid risk. Cancer care and recovery after surgery require professional assessment of health status, the area involved, and necessary precautions. A preventive promise may sound reassuring, but can create expense or anxiety without a measurable goal. Appropriate information, monitoring, and dialogue with the care team offer a stronger basis. If a symptom appears, it should be described and assessed rather than automatically massaged. 3 promises require immediate caution. The first says drainage detoxifies the body, as though vague symptoms proved something must be flushed away. The second links it with weight loss or removal of fat. A temporary change in appearance does not demonstrate fat loss. The third promises cure of lymphedema or a permanent result. It ignores variable responses and the need for follow-up. These claims often use confident language, striking images, and simplified biology. Marketing strength, popularity, or price is not evidence. An honest proposal separates the intended goal, what has been observed for the individual, and what remains unknown. It does not turn possible symptom relief into whole-body repair. Rejecting absolute claims protects a genuine experience from exaggerated interpretation. A wellness service may legitimately focus on relaxation or comfort without becoming treatment for lymphedema. Clinical drainage, by contrast, belongs to diagnosis, precautions, and evaluation. These settings do not need to be treated as enemies, they need accurate names. Confusion begins when a relaxing service borrows medical terms to promise and improve an effect, or when a pleasant sensation is presented as evidence of lasting transformation. Clients should know what is offered, by whom, for which goal, and with what limits. Qualifications are especially important with a medical condition, surgery, or cancer history. Clear communication respects the choice to seek wellness while directing unexplained symptoms toward clinical assessment. That boundary reduces delayed care and unrealistic expectations without dismissing comfort. Some symptoms require stopping massage and seeking prompt medical help. A red, hot, painful area, especially with fever, should not be treated as a routine appointment. Sudden or one-sided swelling also needs evaluation before drainage. Chest pain, faintness, or unusual shortness of breath makes the priority clear. Stop and get appropriate help. These signs do not allow self-diagnosis. They show that a cause needs professional investigation. New, persistent, or painful swelling also deserves advice. A gentle technique does not remove the risks of an unknown situation. A prepaid package, scheduled appointment, or previously good experience never outweighs a warning sign. Safety begins with postponing the technique when health status must be assessed first. Contraindications and precautions vary with health status, the body area, and recovery after surgery or cancer care. A demonstration without assessment cannot account for those variables. It may show a movement, but not the reasoning behind indication, sequence, avoided areas, or the decision to stop. This episode therefore provides landmarks without teaching a method to copy on yourself or someone else. Professional skill includes manual technique, clinical reasoning, and referral when needed. Health history and medications should be shared before treatment. Recent surgery or cancer care is not a minor detail. It affects adaptation and possible coordination with the medical team. General information improves dialogue, while individualized assessment protects the decision. Confusing the two creates false confidence in circumstances requiring expertise. Simple preparation turns a general expectation into a useful conversation. Note when the symptoms started and whether it appeared suddenly, progressed, stayed stable, or fluctuated. Gather medical history, previous procedures, and current medications without deciding what is irrelevant. During the visit, ask for the precise diagnosis, the measurable goal of drainage, and the method and timing of reevaluation. Verify the practitioner's relevant training and understand where the technique fits among other measures. Ask which precautions apply and what would lead to stopping. A schedule should have a clinical reason, not merely a commercial routine. After the agreed period, review the actual benefit. If the goal was not reached, adapting, stopping, or seeking another opinion is more reasonable than continuing from habit. Manual lymphatic drainage is a possible tool whose value depends on sound diagnosis, realistic goals, and appropriate care. It may relieve certain symptoms for some people without permanently eliminating every lymphedema. Used alone, it has not shown a consistent effect on volume. Within structured care, it may complement compression, appropriate movement, skin care, and education. Its value should be judged against a defined, observed, and reviewed benefit, never an absolute promise. A warning sign or unexplained swelling always returns priority to medical assessment and investigation of the cause. This general information does not diagnose, prescribe treatment, or replace supervised instruction when needed. The next episode, Why Drainage is Not Always Enough, will explain why a broader strategy is often necessary. Write down your observations and ask for a measurable goal before starting or continuing sessions. Join NewPod next time to explore the limits of drainage and the care that may complement it.